Hey guys, this is Dr. Hub. Today we're going to look at the nerves of the larynx. So to begin with, we will be drawing a flow chart so that it's easier to understand. So the vagus nerve, first is the parent, that is the vagus nerve. It is divided into two, that is the main branch being the superior laryngeal nerve. So there is a superior laryngeal nerve, and then comes there is a recurrent laryngeal nerve. So these are the two main branches. So now let's divide the superior laryngeal nerve. So in terms of the superior laryngeal nerve, it is divided into two. That is, there is internal laryngeal nerve. Next comes the external laryngeal nerve. So this internal laryngeal nerve as well as the external laryngeal nerve. So the internal, there is the sensory supply. It is to the mucosa. This is completely the internal laryngeal nerve. So if you see all this, it comes under the terminal branches. So this sensory supply is by the mucosa, and this is above the vocal cords. This is the sensory supply above the vocal cords. Next comes the external laryngeal nerve. This external laryngeal nerve, it supplies a motor supply. It gives motor supply. Internal is sensory supply. External will be the motor supply. It gives to the cricothyroid. Then we move on to the recurrent laryngeal nerve. So as a main branch, there were superior laryngeal nerve and the recurrent laryngeal nerve. So this recurrent laryngeal nerve, there is a sensory branch and the motor branch. So looking at the sensory branch, it is for the mucosa below the vocal folds. So it is a mucosa below the vocal folds. Whereas looking at the motor, in the motor, what it does is all intrinsic muscles of the larynx. So all intrinsic muscles, and this is going to be of the larynx. And what is an exception? There is an exception, that is except the cricothyroid. So this was all about the nerve supply of the larynx. To learn and grow daily like this, please do subscribe.